As you bring your patient back from the reception area, be sure to look at their face and neck for any abnormalities. First, I'm going to palpate the occipital nodes. I'm going to have my patient lean her head forward and hold her hair up for me. And I will do circular motions starting just above the hairline, going out to the sternocleidomastoid muscle, and being sure to cover above, right at, and below the hairline. You can put your hair down. Next, I'm going to palpate the post and pre-auricular lymph nodes. So I'm going to start on the post-auricular lymph nodes, and while I do that, I want to look at the back of the ears just to be sure that there's no lesions or any abnormalities there. I'm going to start on the post-auricular lymph nodes and palpate in a circular motion, compressing the skin against the skull. And now I'm going to palpate the pre-auricular lymph nodes. Okay, next I'm going to feel the parotid gland. You want to put your hands straight over the cheeks like that and do palpating circles. And while I'm here, the masseter muscle is in this area, so I'm going to have my patient clench, and you should feel the muscle pop out. And then I'm going to come up to the temporalis muscle, which will be at the temples, and have my patient clench again and relax. And you should feel the temporalis muscle pop out there. We're going to do the TMJ now. You want to put your fingers right in front of the tragus and have your patient open, and your fingers should slide right into the TMJ joint. So I'll have her open and close several times. And now open a little and slide your jaw side to side. And then now stick your jaw out and in. Okay. Next I'm going to feel for the submental lymph nodes and feeling the mentalis muscle at the same time. Now I'll move back to the submandibular gland and submandibular lymph nodes. If you would raise your tongue to the roof of your mouth, that will let you feel the submandibular glands a little bit better. Okay, you can relax. Now for the submandibular lymph nodes, you want to take one hand and push the skin underneath to the side, and that's stabilizing that area, while you pull the other side up over the mandible and let your hand fall down. And if you feel any lymph nodes here, they will just pop over the border of the mandible. And we'll do the other side. Okay, next I'm going to feel her sternocleidomastoid muscle. So I'm going to have her turn her head to the left and put your head down just a little bit. The sternocleidomastoid muscle will start down here near the sternum and come up behind the ear. Be sure to not mistake this for the muscle that runs right along here. Make sure to look at the sternum for the start of the muscle. So to feel the cervical lymph nodes on front here, I'm going to grab the muscle and rotate backwards so that any lymph nodes I would feel them as I rolled over the sternocleidomastoid. And then I want to feel the posterior lymph nodes with palpating that area all the way up to the ear area. And we'll do the other side the same. Okay. Next I'm going to check the thyroid gland, and what you want to do is feel on either side of the larynx and put your fingers there and have your patient swallow. And you really should not feel anything. If it's normal, you should not feel the thyroid gland. And then displace the trachea to one side and palpate and do the other side. And the last thing I'm going to do is check her supraclavicular lymph nodes, which are right inside her shirt on top of the clavicle. So I want to be sure that it's okay that I put my hands just inside your shirt. Is that okay?
Yes.
Okay. So that will be located right along the clavicle here. And we'll use palpation in circles on both sides. Okay, and everything seems to be normal.